Welcome back to Basically EMS. My name is Kylee. This is another episode of Women in EMS. And we're back here with Tessa and with Don. If you saw our previous episode, we chatted with them for a bit. If you haven't seen it, go back and watch it. We are going to be tying into some of the questions that we talked about before, but also I think we had like an hour and 15 minutes of us chatting before. So I wanted to follow up with you guys because we had a lot of questions that we didn't get to finish the last time. So first of all, though, how are you guys doing?
Well, very exciting thing. I just passed my advanced EMT, so that's big news since last time. So
very cool.
Very exciting.
Thank
you.
Cool. What's life like out there, Dawn?
Same old stuff.
Same old, same old. We're dealing with, well, I guess now you're done with the 100, is it the Deadly Days of Summer, Memorial Day to Labor Day, right?
Yeah, I'm not on the ambulance as much anymore,
Sure.
so I don't see that stuff. But yeah, it's been a busy summer.
Yeah,
for everybody.
It's 911 doing what it does. So, all right. Well, so the last time when we kind of finished off, we were talking about some of like the advice and things that we have for other people, and I think that'll just kind of come along with it. But if we want to tie back into some of the questions that we were talking about before, it was a little bit more of like the almost admin side, right? Of like, have you ever had a female boss? You know, like if you had female partners, what was that like at your department? So we talked about it a little bit, and I think you and I have worked together before. We had females in leadership. What about you, Tessa?
Not particularly. On the volunteer fire department, we did have a woman that was in charge of like all of our medical training, so that was pretty cool. But then the other ambulance service I worked on, we didn't really have a lot of women in direct leadership roles. We had kind of the supervisor of the whole ER was like way up there and very unreachable for us. And then under her, we had kind of like the director of the ambulance services and like operations manager and everything, but they were all males. And yeah. So kind of interesting.
Yeah.
They all worked very poorly together as far as communication goes. That doesn't have anything to do with gender at all. But
it's the downfall of any kind of structure, right? Is communication between. And I mean, if you look at the rural departments that you've worked with as well, that can definitely make sense.
Yeah, absolutely.
So, you've been a female in leadership, right? For a while, right?
Yeah. I took a different position in a small rural area for a while that was kind of a manager of a rural EMS department that was an eye-opening experience, to say the least. But yeah, currently I'm a captain, but I don't supervise anybody. So.
Well, and I guess when we talk about leadership, too, there's various capacities of that. So you're a captain, which means she's in a higher level position, right? So that in itself carries its own. You're maybe not directly supervising people, but you do have a lot of responsibility that falls onto you, especially, I mean, you're one of the pinnacles, I think, for a lot of people as far as, like, a woman who's been in EMS for a long time, you know, who's fulfilled a lot of different roles.
I do get a lot of questions. I mean, in that, there's because of this specialty role that I have with a community paramedic, get a lot of questions from people on, calls that are just kind of outside of the norm, especially that have to do with, psychosocial things, a lot of elder care issues that come up, anything that has to do with how somebody is kind of goes through the spectrum of healthcare. So I get a lot of questions about that because we just don't learn a lot about it in EMS at all. So
community paramedicine is so cool.
Yeah.
Did you have that?
We had the idea of it, and then we had like one person for our entire 2 counties, which did and did not work. Very different than I think how it's run here. So I think it's something that we would see a lot more of, kind of as like there's changes that happen where I worked, but it existed, but it was never something we thought about calling. We were like, we're just going to figure this out on our own.
Would you mind actually explaining that role? I think there's probably a lot of people out there that are listening that have no idea what community paramedicine actually is.
So it kind of looks different depending on where you're at. I mean, that's what the whole basis that they say it, like it fits the needs of the community. in Ada County, we were one of the first that started a community paramedic program in the nation, actually. And then it kind of exploded after 2012. But a lot of places have found a really hard time coming up against reimbursement, any kind of like figuring out what their population is and where they can make the most impact. There are tons of challenges with data collection and patient records and continuity of care issues. But really what most EMS systems that adopt community paramedicine or mobile integrated healthcare do is kind of fill the gaps and try to be more proactive rather than reactive. So it's finding those needs that would maybe say cause somebody to call 911 frequently or cause somebody to fall frequently. They also help with like alternative destinations. So it's one of the things we do with our program is get people into mental health hospitals, crisis centers, liaison with treatment providers and 988 rather than always just taking people to the ER. So it is, it's a slower pace of EMS, but it's a lot more problem solving and a lot more pulling in resources from all over, which was a huge eye-opening experience for me. I didn't, you think because you're an EMS, you go to the hospital, you know what this means, but it is a whole wide world out there that most of us don't really understand as much.
Yeah, well, and the filling the gaps, and that's more so of a conversation about community paramedicine that we can have another time. It would be great just to talk more about because it's becoming a thing. But that actually kind of feeds into my next question of we're talking about women. I feel like that's a great role for women to fill. I know we have our male providers and they're fantastic as well, but I think as far as picking out or maybe recognizing some of the things without training is already something we do. We're already kind of good at filling or finding those little cracks, if that makes sense. Do you feel like you fell into it maybe a little more naturally?
I don't know. I think that I was interested when we started the program. I'd been a medic at Ada County for 8 years, at my department. I guess I shouldn't say. Sorry.
Let's bleep it out.
Yeah. And I was more interested in because I had seen what kind of how the healthcare system fails a lot of people that don't have either healthcare literacy. They are challenged with transportation. They're challenged with financial issues. And we end up being the safety net all the time. And it's easy to get burnt out with calls like that. And it's also easy to be really dismissive of people. And so when this opportunity came forward, I thought, this would be a great opportunity to learn more about what are some of the challenges and why are people, calling continually for low acuity kind of issues and why do they have difficulty with medications and following up with primary care. And like I said, it was a huge eye-opening experience. It still is. I still, I've said this for years, if you don't learn something every day you go to work in EMS, then you're not paying attention. So, and I still do, when we dealing with this different population and these different call types, it's still a learning experience. But as far as the influence of being a female in there, I don't know. Honestly, when we first started, I was the only female out of 4. So I don't know that was my primary driver, and I don't know if that's the primary driver for a lot of people. But I do think that in order to do community paramedicine, you have to be curious about people's circumstances and be empathetic to their challenges, and that. Maybe could be viewed as more, but I think that's individual to everybody, honestly. So
and I that's kind of in line with what I was, you have the obvious differences between you've got, the characteristics of males and then your characteristics of females. And that's honestly where I always kind of wonder, you hear about where we split up in EMS. Like you were saying, you went community paramedicine, I went education. You're going a little bit more like wilderness, if I understand correctly.
Yeah. Well, I actually just got on with, I guess I shouldn't say that either.
With the local department.
With bleep. No, but
yeah,
so I'm going back to the truck.
Okay.
Yeah, that's kind of the path. But I definitely went down the teaching route and then kind of decided I wanted to go back on the truck. But I do think for me, teaching is way more gratifying than working on the ambulance. Sure. But I think it'll be good either way.
Yeah. Well, and I think while we're, talking about how we kind of fit, what you said, it's all individual, right? But recognizing not just the qualities you have as a person is important, but also, it's that good old some or women just tend to do things better in this area. Men tend to do things better in this area. Whether that's, you know, what you want to hold yourself to or not, very much depends, you know. But like, for example, we see women in tactical all the time. And, you know, we think about it, and I think people are used to seeing like, oh, big, burly SWAT guys, you know, and there are tons of tactical paramedics out there that are petite young ladies like, you know, like myself or whatever. And I guess that kind of is also playing into what I was talking about. You know, like, it's interesting to see how women have kind of, I think, I always liked education, but I think it's very natural for us to fall into those roles of being an educator, being a mentor, or whatever. But there are a lot of really cool chicks out there that are doing these like specialty programs. Like, a lot of people don't even know community paramedicine is a thing. So whether it's about being a woman or not, it's really about who you are. But it's cool that women are starting to pop up, and those traits that they have as a person that maybe you're feminine or not are still valuable. And I think that's cool because, I mean, when I was starting off, well, a gal that comes to my mind, she was a tactical paramedic for a long time. And it was one of those things where I was like, oh, that's really cool. I personally don't feel like I can offer that much, you know, in the way of maybe physical or whatever, but there's still a spot that I can find what I'm good at and feel like, or, you know, use those characteristics for it and those qualities. And remembering there's education, there's community paramedicine, there's tactical paramedicine, not just paramedicine, but EMS in general. So you don't have to be limited, I guess, and I think that's really cool.
Yeah, I think that's a good takeaway point of that, is just like, while there are like niche areas that we tend to fall into, we are absolutely not limited by like what people think we should be doing or what we think we should be doing. Yeah,
and I mean, there's, you know, a lot of those, which Don and I were talking about it a little bit, like stereotypes. You know, like, we should be kind of behaving a certain way, or we should feel a certain way after calls and things like that. That, you know, I don't know. When I say, like, I go into education, you know, there's the stereotype of those who can't do teach or whatever, which I think is so funny. I don't know. Chris is back there, and he's going, oh, yeah, as an educator, you're like, wow. And when we talk about stereotypes, it's more towards our gender, right? Like, that's the whole thing, which again, is why I was bringing it up in the case of other roles. You know, you hear a lot of those stereotypes, and I mean, have you noticed any as like a newer provider that have been pushed onto you?
I actually think I've had a really good experience, like, gender-wise. I don't feel like there were any roles that were pushed onto me. I do think it's just like common practice that if you have like a young female and you have a young female provider, like, you're gonna pair them together. You know, if they don't need like
Sure.
Just so like you have your comfort of your patient that you're considering in that, like, they might be more comfortable with someone similar to them. But other than that, really haven't like been pushed into certain stereotypes or anything like that, which I think has been good.
Yeah. And for you, Dawn, like, you've seen the progression. You know, you've seen all the changes that come up. And
I feel like I should be walking with a cane.
I know. I'm sorry. I hate doing it to you, but it's so good. It's so good. You have such good experience. I'm so sorry.
No,
if there's a better way for me to not
it just makes me laugh.
Yeah. We can come up with a code word if you want. If it's starting to hurt your feelings.
No, it's not hurting my feelings. It's just sometimes I'm like,
Sure.
I am old, man. I didn't know that happened. No, I think that honestly, I don't know that it's changed a ton in the 20-something years. I think that obviously the visibility of women in both the fire service and in EMS and in law enforcement has increased a lot, and that is helpful to all of us,
Right.
Regardless of what positions you choose to be in, and I think it's helpful to all of humanity, and not just as women, to see that capable people should be in positions and in jobs that they're capable of. I think there are still some ingrained, I hate to throw out the M word, the misogyny word, but I think there's just some ingrained things that are part of our culture that are difficult.
Like EMS culture, you mean?
Yeah, I think just culture in general.
Yeah.
If you're a young, cute girl starting out, it's all the guys are gonna be chasing after, and they have a hard time being taken more seriously, and that's not fair. You should be judged on the basis of your merit and how well you perform at your job, not if you're cute. And
so you're saying like that stereotype was there when you started, and obviously it's still very present. So the stereotypes are still there, but maybe like the actual amplitude or
I think
frequency.
I think it is less. And obviously, I'm not a young, cute little female, so I don't know. Maybe it is.
You definitely are, Dawn. You 100%
But
are.
I mean, I still hear rumblings of those
Yeah.
things happening and of people being treated differently because of how they look and how they act.
Sure.
And
looks-
when I say act, I don't mean like non-professional. Sure. I just mean like you're young and maybe your voice is pitched a little higher, or you wear more makeup, or you
Sure.
do your hair, whatever. Like those things don't have any bearing on somebody's ability to do a good job, and yet they can be something that somebody's judged for. So.
Speaking of makeup, I'm so glad you brought that up because a quick question, you don't wear makeup on shift, right? Do you?
No, like mascara and that's it.
Sure.
Yeah.
I did for like a little, like I think the first year, and I think it was more so just, honestly, I was putting on my battle face. I was getting ready in the morning, like feel good or look good, feel good kind of thing. But I got a lot of people who gave me shit. Sorry, you might have to bleep that out too. Who gave me crap for wearing makeup and just wanting to do the basic like feminine things, like wearing earrings.
Yeah. Or if you like show up to shift and like, you washed your hair and it like looks a little different. Like people are like, wow, you look so good. And you're like, okay.
It's the whole sick
thanks.
thing,
like,
right?
Yeah.
You're like,
or like you're a
feel
little
me?
tired
Yeah.
or like you look a little sick and you're like, okay,
I'm
well, you
tired
do
'cause-
too.
Yeah. Yeah.
I'm tired because I just worked a back half
Yeah.
and ran 5 calls after midnight. I'm not tired because I'm just, my favorite thing was, and it's not fair, but I'd be like, no, I'm just ugly. And they'd be like, okay. And
This
I'd be
is
like,
just my
right,
face.
it doesn't matter because
Yeah.
it
Yeah.
doesn't matter.
Yeah.
So yeah, that's one of those things that I actually have a lot of girls that come up to me like students, and they're like, how should I, like, do I do my hair? Like, I see a lot of girls that have their nails done. That stuff's up to your department. That's up to your department,
yeah.
right? And that's, I don't know, I have thoughts on nails just from a hygiene standpoint, but like,
Yeah.
I don't care if you want to wear earrings. I think people look at it and maybe their view on it is like, we just have this need to look good, but they forget that there's very much the intrinsic value of getting ready.
I had a supervisor kind of give me a little bit of a raft of crap once for wearing dangly earrings. That's probably the only stereotypical feminine thing that I ever wear. Or
I was
period.
going to say, dangly earrings are kind of like your
I always
thing,
wear them.
yeah.
And he said, well, what if somebody reaches up and grabs them? And I was like, if somebody's getting that close to my face, we have bigger problems.
Yeah.
Like I
Absolutely.
should have more situational awareness than allowing somebody to come up and grab an earring.
Right. And that goes back to the advice I think we gave, on the first episode where we were like, just, consider the things like, hey, wear your hair in a braid, right?
Yeah.
And that's where I think a lot of maybe some of the things that people have beef with come up is you'll see gals with this like long flowing hair and they're like, dude, put your hair up.
I just think it's gross. Like,
well, and that's what I mean.
you want your
like,
hair
Yeah.
to smell like these
Yeah.
houses we go in?
So just use your common sense and you can still be a very feminine woman, right? Just like braid your hair, keep it out of the way. You can still show your pretty long hair, or whatever you want, but just, making it applicable to the job. And it's people who maybe don't want to sacrifice certain things like, putting their hair up or whatever like that. Does it matter? No, it shouldn't matter. But I think those are some of the things that people cling to. You know what I mean?
Well, and
Yeah.
it's whatever gives you the confidence, like you said, putting on your battle face. If that
Yeah.
gives you the confidence to go out and do your best job, then do it. It's not.
Who cares? Just
yeah.
wash your face at night.
Yeah.
Just wash your face. I don't care what you do on shift. Just wash your face at night.
That's especially in the beginning of your career, like you take whatever you can to help you
For sure.
get through the day and not, cry yourself to sleep at the end of the shift. I
Yeah.
screwed up so bad. So,
Yeah.
and I hate that the fake it till you make it thing, but if it's something that gives you genuine confidence in your ability to present yourself in the world, then go ahead and do it.
Yeah, just be smart about it, right? And that's why I said, like, you can still do it.
Yeah,
And
fake nails might be a little bit of like that, but anyway.
I can't do it. The thought of, like, damaging or, like, having the nails bent back is the thing that I lose sleep over. I literally lose sleep over that. So, but again, there's no, like, the judgment side of things. I don't care what you do. Just follow your department's policy.
Yeah.
That's like, all they're looking for. And then, if someone does have a problem with it, they're thinking about things that literally no one else is thinking about or most people aren't worried about. So, I mean, that's kind of the one thing I had to tell myself is where I was like, why do they care?
Yep.
Who cares? I'm a good paramedic and I just ran that call really well. You know?
And that is what matters.
Yeah.
Exactly. Yeah. And so I kind of mentioned your, like, you know, what things you've seen change over the years. I'm curious for you, Tessa, as far as like when you started, you're a few years in, right? When you first started, have you noticed any changes just in the few years for anything, culture, behavior?
Yeah, I think just from like different places, because I've been in 3 different states now, and kind of like seen EMS in those 3 different places. And I think they've all been like very rural, except for like Current is a lot less rural. So I think that plays a lot into culture because you're seeing a lot like older practices. You see a lot more like male dominated fields, very few women involved in all of the things. But then the women who are involved are like the coolest people ever.
Right.
They're
the OGs.
Yes, yeah, and then just like the young people that are like getting into it they have a lot to offer. As far as changes go, I don't think my department was like super progressive in any way, so it was like we kind of maybe were going backwards, and that was really frustrating trying to be like taken seriously. And like I look really young, I'm really short, like you know,
I get it.
and so sometimes it's like you show up, and I think the thing that I hated the most is like, are you old enough to be doing this? And you're like, yeah, I'm not 12. Like they don't let 12-year-olds ride on the ambulance.
Yeah. Yeah.
But yeah, so I wouldn't say I saw particular changes. I had a really unique EMT like class experience where I was with all like tactical Air Force men, and then it was like me, like single civilian. I don't know how that happened.
That was very good.
Yeah, it was super bizarre. So I think like I maybe was a little desensitized going into EMS because
That's what I was
like
gonna ask.
yeah, my
You're with
whole
a bunch of military folks.
yeah. So my whole EMT experience, I was like, is it gonna be like this all the time? Are we always gonna talk about eyeballs? Because I don't want to.
Oh gosh, those military guys love talking about
Oh my
eyeballs.
God, they do.
Love it. And needle decompression.
Yeah,
That's the other one.
Yeah, that's definitely the other one. So that's kind of my take on it. Is I started out in like a very aggressively one side way of EMS, and then I was like, okay, it's different everywhere you go. Yeah.
I feel like, because I mean, I started 11 years ago, and I started off in the fire service. So in the last episode, I kind of gave my history a little bit of, I was encouraged to go into the fire service by my chief. He approached me and he was like, we want more women, you know, and I was, first of all, floored. What a cool thing to have, you know, 11 years ago. I mean, I was just getting into the field, so I don't know what it was at the time, but it felt very, very unique and very special because his approach was, we want you. We're not just going to have you guys like come to us and apply here. Like, we want you guys. Cool. And having that was really cool. And the support that I got from that, I mean, I still have that support. The next department I went to go to work for, I had that support. And then the agency you and I work together at, you know, we have a lot of female or women in leadership just in general. And so I think I started off in a really good spot. I definitely had my issues with things, but I was really fortunate to never really go below the baseline of what I deserve. You know, like the agencies that I worked for, at least as far as, you know, feeling there's always going to be things that they could do better at, you know, but I never felt like if somebody said something to me and I reported it or something like that, then no one would listen to me. I do feel like I had that. It might not have been the perfect process because, you know, processes and departments are their own thing when you're getting into like harassment or whatever. I've definitely had my issues with that, but overall I think the resolve that I had with my situations could have had a lot of really bad potential. You know, like they could have gone poorly, but I was really fortunate to have departments. I don't think the field has maybe changed as much as just the people going into the field have maybe changed. And I think a lot of that has to, and I was kind of thinking about it when we were talking about it, because we were all like, but it hasn't really changed, and maybe it's because the younger, well, I suppose you're kind of in a different wave, I suppose, of EMS compared to like when I went through EMT school, in that, you know, like we've almost got like different generations going on here, and we're all saying the same thing. So it seems to be that we're all we're getting more, maybe more like vocal and more like women with maybe a little more bravado or something like that are approaching the field. Does that make sense?
Yeah, I think honestly, just from, I think in general, people that are, you know, the not even really millennials, but more the next generation. Was that Gen Y?
Gen
Y?
X?
No, that's me.
Oh, we're going down. Yeah, the Gen Y, Gen Alpha.
They have tended to be raised more emotionally intelligent than the rest of us were. They have grown up with the idea of, somebody's mental health and, respecting the rights of other people. And the world's not perfect by any means. But I think that just inherently, sexual harassment training when I was, starting to work, 30 years ago, 40 years ago, no, 30, was like everyone was like, this is dumb. And now it's just part of the thing, you know? I mean, you still watch the sexual harassment videos and think, wow, the fact that this had to have happened to make it on video is impressive. But it's more of somebody's part of lexicon, right?
Yeah.
We're more attuned to the idea that
society develops.
What is acceptable and what is not. And I think there's a general willingness of coworkers and admin and our bosses to step in immediately and recognize independently without being said, hey, this was offensive or whatever. They can say, like, don't talk to somebody like that, or don't put them in that position. And I think that ends up self-correcting a lot of things more often than they did before. It used to be, if something happened, you had to be the one standing up and poking your finger at somebody and say, do not talk to me like that. And nobody really else may not necessarily have your back. But I feel like the culture has just changed with people recognizing it a lot more.
That's kind of what I was saying as far as like my agencies. Like definitely, there's always, you're going to hear people complain about whatever agency, how they handle something. When it comes to like the sexual harassment side of things, I felt so much, or any of harassment, I felt so much more comfortable over the years actually going and talking to people. I think a lot of that comes from, standing on the shoulders of giants. There are a lot of women who helped set the stage so that we could have that anyways.
Absolutely.
But that's one of those things. If you are someone who experiences that or has experienced that, it's one of those things where like just because we're sitting here saying like we had pretty good experiences, that doesn't mean that people out there don't have bad experiences, and that doesn't mean that we haven't individually had our own bad experiences. Unfortunately, I think as long as you're in a position where we're in a job that's as unique as this field, I think we're always kind of going to be, especially because of the generational things you were talking about, we're always going to be combating things to some extent. And just kind of, like we talked about in the previous podcast, just doing this is one of my favorite things that I think of, like conversations I've had with people, because we basically said, you're worth getting to know, like your gender doesn't matter, you need to be a good provider. And so that's a nice thing to lean on to. And I think people are very much embracing that now. Like people are just saying like, you know what, Tessa, you're a good EMT. Your gender doesn't even matter. Yeah. And I do
think that's way more common now. Even just from like friends that I know that have been in the field for a long time, just their experiences now versus then of like, you do have to earn your way a little bit in the beginning. But once you like prove yourself competent and capable, then it's like, yeah, you are respected for that. And I really did find that in like my last agency. Like after I got to know people and I proved that I could do it, they were like, all right, she can do it.
Yeah.
So.
Well, and as far as proving yourself goes, where do you draw the line?
Yeah.
Where do you, and I think that's one of the things, that's where I get a lot of young gals that have asked me about like, at what point, how much should I be willing to bend? Because you go to like these rural departments, and nothing against rural departments at all. When you get into EMS with talking about rural departments, you have to appreciate the lack of funds and lack of resources and all of those kinds of things. So this isn't any hate towards them. It's just not consistent. It's something that comes up, right?
It definitely does.
So with you though, with that whole topic, was there any changes in the few years in your area maybe?
No, not like changes systemically, but like I said, I think everyone that I worked with, if you could, and this goes into like proving yourself and then drawing that line of like, where do you stop proving yourself? But if you could prove to them that you could run a call and you could competently do the things that you were supposed to do, then you had the respect. And that's kind of like where you could draw the line. I didn't feel like I had to constantly be like, oh, I have to put my best foot forward and I always have to be like 120% of myself to like make them take me seriously. It was like they allowed me to show up as me, but it took a while for them to be like, okay, she's cool, you know? So.
Well, and how much of that is just resistance versus being afraid to.
Yeah. So that's another thought too of like, you know, I definitely had some like male counterparts hired at the same time, and they were all buddy, you know, and they were like, oh, he's cool. And I was like, he doesn't even know how to do an assessment. Come on, guys.
Yeah.
And sometimes that's no shade to men at all. It's just like in certain
good old boys
situations, yeah, it's like, yeah, they're a buddy. They know each other from this and that. They worked on this volunteer department. They have that history. So they're like, yeah, he's cool. And you're like, okay, sure.
Do you feel like a lot of, like in that situation, do you feel like they were kind of given some of that like from the get-go? And purely because of like the camaraderie of it?
I do think so. And then it's like such a small area. Again, when you're working in rural, like so many people know each other and do have that history, or it's like their dads were friends, or like, you know, they go back a long way and everyone knows everyone. So just depending on your relationships and your connections, like that all plays into it too. So, yeah.
Yeah, and I guess, and so you have first responders as family members as well. Have you compared your experiences with, or even, I know one of them, they're in like a different role, but have you talked about that? About like, I guess I don't know your guys' history as much either, if he went in or you went in first, but.
Actually, he started before I did. We started, my brother brought me into volunteering at a fire department with him, so we worked together at the same volunteer department for a little while. It was an interesting dynamic.
Yeah. Is he older than you?
No, he's younger than I am.
Oh, okay, cool.
Just by a year. So,
okay.
So we had, and he started professionally. We got a real grown up full time job before I did. So
the big kid fire job.
Yeah. So I think obviously his path has been a lot, different than mine has. But it was, my choices were based on finding the things that I originally thought I wanted to do fire as well, but I really like medicine, and so that's what I went into. But
did you decide you were too smart to die in a burning building too? I always say, I'm joking. I love my firefighters, obviously, but I always kind of make that joke of like that. And then I went to paramedic school, so how smart am I?
Well, for me, it's just the medicine. I missed. When I started working as a medic, I missed the physicality of fire because I'd done wildland before, but I really enjoyed the medicine. But I think the paths and the stressors are similar when you're starting off in a role as a medic versus a role as a firefighter on an engine. There is, because of the lack of command structure that EMS tends to have, and we work more like cats.
Herding cats.
It tends to, I think, develop more of a, almost like an independent practitioner view of things versus when you're on an engine. It's much more teamwork and it's much more command, structured. But and so the career path is then different, right? Sure. And your advancements are still different. So it's not necessarily that he's a dude and I'm a sister. It was just that our departments were different in how you could advance. And I think that's one of the disadvantages of EMS is that the career path isn't as defined for most places.
Sure.
And so when we look at like how do we give more opportunity to women in EMS, I think it's a broader question of how do we open up opportunity for anybody in EMS.
Definitely.
Because I don't think there is not there isn't the ladder necessarily for people to climb. So.
Well, and I think as far as the ladder goes, I think there's a lot of people who I think assume that every single person wants to climb that ladder in some way. I definitely had like my own internal ladder to climb. And this isn't necessarily just specifically because of me being a woman, but I had my own version of that within the fire service and with, paramedic school. And this is a little bit more of the personal side of things, but I do think the ladder for me, and this is an important thing for anybody in the field to remember, is that the ladder is what you make it. And then also remembering, though, since we are talking about the women in EMS, if you are talking about, wanting to climb that ladder and all of those things, it's just like any other field. I think in like the things that you hear from people, maybe unfortunately we go back to some of those stereotypes and stuff, but I don't want that to discourage anybody, because climbing the ladder is all, I think, a very personal experience. Climbing the ladder for me wasn't going into leadership as much as it was going into a role where I got to work with interns, or something like that. And again, it's kind of same what you were saying. I just picked what worked for me, and it ended up flowing well anyways, and my gender became less of an issue, and it became more of a, am I suited to do this job? And that's what we keep saying over and over, but I think a lot of people want it to be something else, instead of just having, hey, you have a male and a female that are here and they're both competent and capable. How do you decide between two? You leave gender out of it, but a lot of people don't want to do that, I think, in certain ways, if that makes sense. Or maybe they don't want, it's not that they don't want to, they just have resistance to it, like we were talking about before.
I think so.
If that makes sense. But I think as we just grow, like, we're just people, and we're all just people that are we're trying to go to work and do a good job. You know what I mean? It's just, the female part of it's a small part of the picture. And
yeah, it really is, honestly.
I guess that's it's simply put, that's what I'm trying to say. It's a small part of it.
I think that the struggle to find your command presence on a scene can be different for women than it is for some men, but not all. And there are different ways of going about it. And I think we talked about last time, the difference between being aggressive and being assertive is, it can be really hard for people to find, especially initially, right? When you're 22 years old and you don't have really any experience in being a leader, like all of a sudden being a leader of 4 people, 5 people, however many people on scene, some of whom are probably substantially older than you, more experienced than you.
That was going to be my thing.
It can be difficult for anybody at that age without having a background of any kind of, not leadership, but just of things that challenge you, and so that's hard for a lot of people. I think generally speaking, women are not encouraged throughout their lifespan to take those roles inherently as much as men can be. So you can be starting from the starting block might be a little few meters behind. Listen to me, meters, Canadian.
We use the metric system here.
Yeah. But it doesn't mean the gap is overcomable, and it doesn't mean that women start here and men start here. That just means their personalities as a general tendency can be. But I've seen plenty of people of both genders flame out and fade away through the years on just how hard it can be to. The medicine is not the hard part,
right?
No.
So
we all went to, we went to paramedic school, we went to EMT school. We've been given a similar formula. The leadership part of it, how you're going to climb the ladder, comes down to like what you want to do. But again, like, it's all very internal. Like, climbing that ladder for you and developing skills, it shouldn't be how do I get to the top. It should be how do I climb the skill ladder, is how I think about it. And for me, scene presence. Scene presence, and trying to make myself comfortable in front of a fire captain who's, I'm his daughter's age, and he lets me know that I'm his daughter's age. And so, trying to naturally overcome that without it being forced, gender aside, I think that's hard. There's a lot of factors that play into it, but.
Yeah, and I don't think gender, it does play into it a little bit, but every new provider, and we see this all the time with our EMTs coming through classes, and then you watch them do an assessment, and then you send them out into the world, and you're like, first step, you have to learn how to talk to people.
Yep.
That's step one. And I really think that is just, everyone struggles with it. And we ran BLS trucks, so I had to be lead provider on calls 6 months into my EMS career. And that was really weird and scary, and people would look at me and be like, what should we do? And I was like, well, I don't know, because I've never seen this before, and you haven't either, so here we are. But, yeah.
And at that point, nobody's gender matters.
No, everyone's just kind of
matter.
We're scared together.
Yeah, right. And, I think, though, that's the thing that a lot of people are just asking for, we're not looking for anything special. We're genuinely just looking to be, have the same opportunity.
Yeah.
I want to take the CPAT test the same way that the rest of my fire academy got to, and I don't want special treatment because that's what it means to be equal, right? It's the consideration that we maybe are 2 meters behind or whatever from the get-go. That's all. Like, I think if you've been listening to us over the previous episode and this one, I think that's kind of the big picture of what we're saying, and you'll hear it over and over. Just treat people with the same kind of expectations that you would have for yourself. And I think that's a really easy way to go about it. I approach calls and I say I want to be the best paramedic. I don't say I want to be the best female paramedic. I say I want to be the best paramedic. Otherwise, though, the intrinsic value, you're going to have to make a lot of that, or not make it, sorry. You're going to have to recognize that in yourself. And that is where also being a good support system for your other providers and your partners comes into. It's not just about gender again, but if you have a female partner or something like that and they're a really strong provider, ask them questions. If you're a young female, I've asked Don, I've worked a couple shifts together, and I was like, hey, I need, like, how do you think I should navigate this? I've reached out to you. So it's not even just, it being about gender. It's just that sometimes I just want to talk to a chick who gets it. And I think that's one of the big opportunities for us to step in and really offer, is women are so special in our ability to connect with people. Yeah. And like, that's one thing that we can really own. And then also people like males can learn that. Men can learn that from us. And I think that's maybe, one of the things about doing a podcast like this is just trying to be like, hey guys, we're all here. We're all here on the same page. Right. Yeah. So.
Yeah. I think finding the internal strength and the confidence to ask people questions and ask for help is also something that it is a learned behavior, and it can be really difficult at first. I remember when I very first started, I'd gone through my internship, and basically when you go through your internship, they want to know that you're thinking about all these things. So you, like, especially the way my preceptor ran it, like, I had to verbalize everything I was going to do, and they expected me to do all of those things. So then when I started working in the field and my partner was like anticipating what I was going to, and they're setting things up, and I'm thinking, I was going to do that. Why are you, like, did you think I wasn't going to remember to do that? And so being able to recognize that it is a team sport, and that you all should be working together, and that it is to be confident enough with your ability to do your job, to relax around everyone, and to be like, we're all here doing the thing, and everybody's, I've got the eyes out on all of it, but I know that you know what you're doing, and I know that you're going to do a good job, and that's that takes a little while to form. Sure. And again, I think it goes back to that aggressive, I don't need to stand over you and tell you how to do something. If you have questions, you can ask, but yeah.
Well, do you guys have any, like, I know we talked about a lot of things, but any last, like, points you either want to reiterate, you really want to drive home, or maybe just a story or anything?
No.
I think just thinking about, like, this upcoming generation of EMTs, we still see so many more, like, male students in our classrooms and everything, but just trying to, like, continue to break those stereotypes, and just, like, finding your intrinsic value as a provider versus, like, using gender in anything. Like, I would love to see more of that, and I, like, encourage people who are listening to this, clearly, like, they're curious about, women in EMS and things like that, but trying to find that, that value that you have in yourself, I think is way more important than being like, yeah, you have what it takes because you're a man or because you're a woman. Like, just should be you have what it takes because you're you.
Yeah. And that's why I think the important thing about this whole thing is that we're saying this for anybody. This advice doesn't apply to just women. And I think that's the beauty of like, when we're talking about pro women, we're trying to, like, bolster us up in that point. Well, we're also just bolstering everyone else up with us. So if you maintain that kindness to yourself that you have for, like, your partners and stuff, it's a great field. I've had a great experience. I'm obviously not working in the field anymore, but I still, like, we interact with students, and seeing people go out there, the emotional intelligence that you were talking about is something that, like, I'm pretty excited for that. Yeah. I'm excited to see people, see, like, that emotional intelligence, but also just see more girls. Just see more girls out there. I've had some girls with some spice. In my class, and I'm always like, like, I'm making the little Kylees, and they're running around out there tormenting these fire captains and police officers.
They should.
Yeah, they should. Yeah, give them a little bit of a hard time. It's good for them, right? Well, I think that's everything I had for you guys. So if there's any last points you'd like to make? No?
I don't think so.
Otherwise, so yes, we're going to continue to do maybe a little bit more interview style with certain providers as well. We're going to be doing episodes of Women in EMS every so often. So if you have any questions you'd like us to ask specifically for either Dawn or Tessa, which thank you again so much for joining me. I'm really happy we got to finish out the questions. That was cool. But if you have any questions specifically for them or for myself, definitely post them in the comments. But you'll be seeing more from us regarding women in EMS. So thank you guys for tuning in. If you didn't watch our first video, go back and watch that one. This is just a follow-up to it. But otherwise, we'll see you guys next time. Thank you, Dawn, and thank you, Tessa.
Yeah, thank you.